Hello, hello. Thank you so much for being here with us today. Let's go right into our first question. So, may
Thank
you
you.
please introduce yourself and tell me a little bit about your personal and professional experiences?
Okay, my name is Howard Hamer. I'm a family physician, semi-retired now, and did family practice for about 33 years, closed my practice about 10 years ago. And all through my professional life, I've also had an interest in occupational medicine, which is the care and understanding of individuals in their workplace and keeping them safe and returning them to work after illness. So in the 90s, I did a master's degree in occupational medicine at McGill, and then slowly closed my practice and did full-time occupational medicine. So what I'm doing now is mainly occupational medicine and only part of the week. A lot of the time I spend in semi-retirement has to do with Ellies Place, with the volunteering that I've been doing as a board member, as well as a committee member and chair of the communications committee. Personally, I'm married, and my wife actually had an initial interest in Ellies Place that I picked up on after a little while. We know the Coopers and knew the Coopers for many years. I actually knew Deborah as a child, and we went to summer camp together. So I've known Deborah and her family a long time. And we have two daughters who are married, both with two children, and they are living in Toronto. So we, before pre-pandemic, have seen them a lot and are involved with the grandchildren. Two boys and a boy and a girl, so three boys and a girl split into two families. And we see them a lot.
So, what motivated you to volunteer for Ellies Place?
Well, knowing the disaster that befell David and Deborah when they lost Ellie, it's going to be about 10 years ago now, really struck home. But I think why it struck home, not that we've had a loss like that or anything close to it, but working in family practice and sitting and listening to young adults, that one in particular that comes to mind, who really had been treated aggressively for his depression for years, off and on with all different kinds of treatments, getting a little better, then a little worse, never really succeeding, dropping out of university, not being able to handle the pressures that he felt, that because he was very determined to feel better, but he just couldn't make it. And there was nowhere to send him. I mean, he had been to the emergency department numerous times. He had been admitted to hospitals and psychiatric wards. He had done all different kinds, been prescribed all different kinds of medications, and with no help, really. He'd feel a little better sometimes, as mentioned, but never really back to where he wanted to be. And when this type of therapy was put in front of me, as understanding the potential of it, really struck a chord with that particular fellow in mind. So I think that's really what motivates me, is that memory.
So, I guess, like, in your line of work, perhaps that experience maybe was also eye-opening for you. And what I'm hearing also shifted your perspective, perhaps. So when you look at kind of like the current norms and what Ellies Place is going to be able to offer, do you think this will be like really great progress for treating mentally ill patients?
Well, it's more of a solution for the puzzle that exists to treating mentally ill young adults, because many persons with mental illness do well in the system we have. So that this is not for persons that present on day one with a new depression and they're 22 years old. This is something that will be used as a therapeutic modality to individuals that have tried the traditional processes and therapies and have failed or have partially failed.
And they're a portion of the population that deserves access to services that suit their needs. So that's why I think it's just so phenomenal. When we look at the actual conversation around mental health, what is it that you'd like to add to that?
Well, there's a lot of talk about mental illness. I'm very much interested in clarifying the difference between mental health and mental illness. It's very much the same as physical health and physical illness. I personally don't differentiate between the mind and the body. They're one. And the interrelationship of the two entities that has been around, defined for over 500 years, is probably a disservice to individuals that are in need of help of any sort, both physical and mental, if you use those terms. But it's important to understand that everyone needs mental health, but nobody needs mental illness. Mental health is something very important that we all need to achieve on a daily basis with all sorts of different ways to do so. And there's many, many different avenues of mental health achievement. But mental illness is a disease no different than diabetes or all sorts of other diseases that we bump into. And they have a set protocol with regard to diagnosis and a set way to treat them for most people that succeeds, if the people are willing to understand and take ownership of the fact that they have a disease process. It's not embarrassing. It's no different than having anything that we have defined in the past as physical. But the interrelationship between the mental and the physical is really quite important. And without it, you won't get as strong a rehabilitation as you might with individuals who do understand that their psyche does help their rehabilitation. It's really quite important to get people like that. They rehabilitate very quickly and they do well.
I definitely completely agree. Like the mind and body are for sure interconnected, and I've even seen that in my own progress with my own journey, how important it is to not just prioritize one and not the other. But when we look at our Ellies Place's tagline, where recovery grows, what does that mean to you? And even in your line of work, how can you tie that into this tagline with what you have seen and heard?
I find it a fascinating tagline because 10, 15 years ago, probably more like 15 years ago and more, in my line of work, recovery was getting better and going back to health and, feeling fine. There wasn't much talk about resilience at that time. And the word recovery doesn't necessarily mean getting better. I did a lot of work with people with chronic pain, Toronto Western Hospital for many years. And I often ask these individuals, you want to be better? Yeah. What does better mean? And asking them better meant no pain, but we couldn't do that because we couldn't get rid of their pain and they had chronic pain. So that allowing them to get better really meant allowing them to understand that what they had was not dangerous, but a huge nuisance. What persons with significant mental illness can be dangerous, but often as time settles it, they're not in a danger anymore. It's time to understand that they have a disease that has to be controlled, may not go away totally, and they may have to adjust to it. And that's where the recovery part comes in my mind, is that they recover from the fear and the regret and the humiliation they may feel about being ill. And they understand that they have an illness rather than it's something that's impacting on their intelligence. It has nothing to do with intelligence. It has to do with the organ, the brain that isn't working properly, and that can be rebalanced mostly, if not totally, depends on the individual and depends on the damage or the illness that's actually present. Some of it's genetic, some of it's how they see themselves. It's really not clear as to how to rebalance, but that's really where the recovery grows. And that's how the individual can recover to a point where their life is different, but it can be just as good as it was before, but it's different. And so is having diabetes. When one has diabetes, one becomes upset, some get depressed, some get agitated, some get angry. But once they get over that and integrate the fact that they have this condition that they have to control and manage, then they recover. They don't get rid of their diabetes, but they recover. So it's very similar in my mind.
Yeah, I definitely appreciate that response. And again, it's almost recognizing that something is wrong and that's okay, and validating all those feelings and emotions and everything that comes with that. And again, seeking help and trying to do the best that you can with what you have. But thank you so much for taking time to chat with me today. I think our discussion was amazing, and there's lots of insights that have come up too, and your breadth of experiences to definitely contribute to Ellies Place. So thank you for that, and we're very lucky to have you.
You're most welcome. It was a pleasure to speak with you.